How to crush medications. Make sure to ask your hospice nurse before using this method because some medications should not be crushed. Always check with your hospice nurse on the best route for administering medication. First, wash your hands with soap and water or use hand sanitizer. Try not to touch the medication with your bare hands. Wear gloves if possible. To crush the medication, use either a pill crusher or the back of a metal spoon and a small bowl. Crush the medication, then put all the contents into a small bowl or cup. Next, draw up 0.5 to 2 milliliters of water into your syringe. If it is difficult for the patient to swallow, use the smaller amount. Add the water from the syringe to the crushed medication in the bowl. Mix the crushed medication and water together until the medication is dissolved. Then, draw up the dissolved mixture into the syringe. With the tip of the syringe in the mixture, pull up slowly on the plunger to draw up the liquid. Be sure to have the person sit up or raise the head of the bed up to at least a 30-degree angle. Finally, slowly dispense all the dissolved medication into the mouth on the tongue, if they are awake and can swallow, under the tongue, or in the side of the mouth or cheek. Northern Illinois Hospice, first in caring for life's final months.